that would be a huge progress for ourselves. Thank you very much.
Can you hear me? Yeah. We always knew you to be an exceptional surgeon and an exceptional human being, but I think I've never seen such honest philosophy from a surgeon ever. So hats off. We stand in this is a panel of giants. So we always, I think from the outside perceived, obviously everyone knows you as the liver transplant person of India who has brought much change and a lot of openness. But I think the honesty and straightforwardness of how you have shown a move from a place of great eminence to make a place of great eminence here, I think is remarkable. And I think in that journey, how you have shaped lives at scale, but with a passion and vision to shape an even greater amount of scale. So really, thank you. I think we should definitely give a proper standing applause for this. Come.
Thanks very much. Thank you.
And please, sir, we'll have a chance to have some questions because we do want this panel to have some questions. And I think this is a little bit more of an unusual panel because we go from the liver transplant person of India, actually of the world, but we now have the patient safety man of India in Dr. Vijay Agarwal. So please, Rambabu, if you could introduce.
Good afternoon, friends. What a feast of talks we have had since morning. Every word spoken has been so stimulating, so enchanting. So thank you very much, AHPI, every one of you, Dr. Gyani, Dr. Alex, for making me a part of this particular deliberations today. Now, we have had so much of Gyan on leadership. The issue is this, that still we keep grappling with one major issue, and that is the issue of patient safety. And you have to see it in the light of that we have been talking about how COVID is Joint Commission accreditation. JCI has been hailed as like the accreditation body in the world. Ladies and gentlemen, that body has been in existence in United States for 75 years. And the deaths due to preventable medical errors are the third leading cause of death in United States after heart attack and stroke. And they spend the money equivalent to GDP of our country in healthcare. So the issue is this, that we keep saying that healthcare is complex. Issue is this, how complex is it? Why is it that we are not able to overcome this? So I think that's where, number one, we as healthcare people have not looked at that what is the theory of complexity. So is it that our leadership has to change according to the level of complexity? So first of all, are we aware about that? Now, there is a complexity theory that I think which the healthcare people now need to be confronted with and must understand. So the complexity theory people have come out with that there are, I will say that the complexity can be simple. Like, for example, if somebody was to run just a kind of a clinic which is doing just vaccinations or something, it's a simple thing that what you know what is to be done, what is the outcome, and that's a simple system. The other is the complicated. In complicated, you know that the interconnected parts do not make right away, it is not a linear approach, but with processes with expert knowledge, most of the times we are able to overcome that, like I would say, even surgical procedures or for any physician for a known disease entity. You are able to diagnose, let's say you are able to diagnose pneumonia, you know how to treat it, and you are able to overcome it. Now the third is the complex. So the complex systems are where the interconnected components keep changing their behavior, and for example, if people with multiple organ failures or something. Now the major difference between complicated and complex have to be understood. In complicated systems, you can think of a solution, but in complex systems, there are not a solution. You can only manage those problems. Now it's very important once we understand as leaders that these are the problems where we can only manage. So after complex comes, there are problems which have been classified as wicked, and sometimes even after that as chaotic. So the wicked problems are like what we had, like the Delta wave in the during the COVID period, when everything goes for a toss and we don't know what to do. So I will say that what are the challenges of applying complexity thinking in healthcare is first, as I said, is the importance of recognizing the level of complexity in different situations. The conceptual confusion is actually between the complicated and complex systems. Most of the times, as I said, culturally we have been brought up to think about solution as the endpoint. We are trying to create a solution. Even now, for example, when we learned to the previous health secretary, you are trying to say, all right, you do this and you do this, and that is what the solution will be for future. I don't think that ever in future also, if there was a situation like that, you can only manage it. There are no clear-cut solutions. Then the way the complex systems have to be managed in the leadership, lot of it has been talked in the morning in the past. Lot of leadership qualities which have been shown in the morning actually are needed when you are dealing with a complex system. One great example of what you can say is to why, when I said why Joint Commission has not been able to overcome medical errors, is because getting an accreditation is a complicated system. You are able to get accreditation because you know what is the checklist, you know what is to be done in the institution. You go and do it on those 5-6 days. Some people in the hospitals are trained to get your examination passed, and therefore that comes under the complicated category. However, to achieve patient safety and to practice it round the year every time is in the complex system, because there is an interaction happening between different patients, different providers, so many touch points, and they keep changing, the behaviors keep emerging, and therefore developing a culture of safety will come under the bracket of trying to develop or managing a complex system. Getting an accreditation is actually a complicated system, but is achievable. And that is why good number of hospitals will keep achieving stamp of accreditation. And unfortunately, most of these hospitals and the accreditation bodies should have given them an insight that the day you receive your accreditation is the beginning of your quality journey. And unfortunately, most of them believe that that was the end of the quality journey. Now we meet again after 1.5 years or 3 years, when the next cycle of accreditation will come, then we will meet. So it is actually to deal with the complex systems. That is where the leaderships, the various aspects of leadership, especially I will say there is a well-known entity now of systems leadership and adaptive leadership. Now these two terminologies came into being to address the complex healthcare system. You do not require that kind of a thinking exactly for just simple or complicated. It is for complex adaptive system. Now, the system leadership this was a term introduced by Peter Senge. This was introduced in 1990 in his book, The Fifth Discipline, emphasizing the importance of managing complex issues. And then there was a little bit different philosophy of dealing the same problem by showing adaptive leadership. This was coined by Ronald AHPI and Marty Linsky at the Harvard University in their work like The Leadership Without Easy Answers in 1994 and Practice of Adaptive Leadership in 2009. The focus, however, remains is addressing complex systemic problems without easy solutions. So again, I would say to emphasize that when you deal with complicated issues, it's a technical challenge. And it can be solved with current knowledge and procedures, often have clear solutions and defined protocols. Like number of our all surgical kind of outcomes, etc. This is a technical challenge. But adaptive challenge requires new learning, innovation, and changes in values or behavior. Solutions are not readily apparent. And that's where you require a adaptive leadership and systems leadership. So the key principles of the adaptive leadership would be that identify the adaptive challenge. And that's where, for example, I will say that we are very proud. At CAHO, our organization, we identified that preventing medical errors is an adaptive challenge. It is very important just not to keep talking about patient safety, quality. We have to say what can be measured. So preventing medical errors, we understand it became a clear-cut goal for the organization that this is an adaptive challenge. What do we do? Why is it that these accreditation bodies are not able to move ahead? We know you are not going to come to a day when you will have a zero error. That's a wishful thinking because you can only manage it. But you can do something more. And what are those issues? The issues are staring in our face. The issue is that the accreditation body has taken away the responsibility of delivering quality from clinicians to the quality manager. They have tried to kind of make it like a technical challenge while the quality has to be delivered in every department. A quality in pediatrics or in cardiology or in orthopedics cannot be delivered by anybody else other than the leaders of that particular department. All the other people, yes, have a role. Accreditation bodies have created a beautiful framework, but the clinicians had to become the captain of the team. So the part of the systems leadership or the adaptive leadership was to collaborate. You have to bring people together. Here the main person who is supposed to deliver quality has somehow become that quality is somebody else's job. I will do just my professional work and get out. Now that's not what is going to reach us to ever a goal of preventing medical errors. And when you look at the hospitals, you see that we talk about doctors and we talk about nurses, but 40% people of these hospitals are people who are neither doctors nor nurses. So at CAHO, for example, in idea to address this, we created forums. We created a forum of engineers, forum of infrastructure engineers, forum of biomedical engineers, forum of pharmacists, forum of clinical dietitians, of rehab specialists, of Ayush people, of housekeeping people. Idea is that every person working in the hospital should be approached. And then the issue is this: accreditation is supposed to do what? It is supposed to judge good practices in every department. But what every department is learning, how do I pass this exam? There is no emphasis on learning good practices, and that's what these forums and all aspects of our functioning started to function, that we must come together and emphasize the good learnings in every department. Let anybody come and take our exam. Unless that approach will come, let NABH come and take my exam, let Joint Commission come and take my exam, let Australian Commission take my exam. They can't change the way a good emergency department should function. They can't change how a good operation theater should function. It has to pass that exam once I know what are the good practices out there. So we had to involve different stakeholders, and then we also forgot one of the most important stakeholder in creating a safer care, and that is the patient. Friends, after long, there was a time when it was only whatever was happening between a doctor and a patient. Medicine about 50 years back was rather simple, inexpensive, and probably not much was done in terms of like the kind of output, let's say what Dr. Ella showed you today, is not what was being done 50 years back. So the patient today has become much more informed. The doctor has somehow remained a little, I would say, unsure about how to deal with this well-informed patient. Sometimes this patient is much better informed than the doctor himself. You call it whether because of Google or something, yes. Now you have to be a stage ahead of the patient to give him the right direction, but you have to involve the patient. There are enough number of studies which have shown that wherever the patients have been involved in their own care, you have produced a safer care. Friends, long time back, we had taken a Hippocratic oath of first do no harm. And I wonder, I'm sure harm must be happening at that time. That's why Hippocratic thought of saying this, that first do no harm. I mean, why would he otherwise come with this kind of a thing at that time, that first do no harm? So obviously, harm has been a part of the healthcare delivery. However, I think we need to understand that today, in spite of the marvelous century that we have had of medical advances in the last 100 years, we are today facing an era of a great amount of mistrust between the community and the providers. And that mistrust is leading to litigations, it is leading to rapes, murders, and violence against the medical professionals, all that you also heard. If we need to stop all that, now, in spite of, naturally, as leaders, somehow people feel that the successful leaders, you talk about those who have made successful balance sheets, the hospitals which have made a lot of money, may be viewed as successful leaders. But I feel that in their balance scorecard, they have to involve the element of patient safety is going to be a very, very important feature. So some of the other features, as we said, was to empower the healthcare worker. I said give work back to the clinicians, encourage input. A lot of things have been already said in the morning, and they are all a part of when you are dealing with a complex system. So all the healthcare leaders must understand, if you want to manage these kind of complex systems, you have to do that. Encourage input from everyone, protect voices, ensure that the input from your frontline staff is heard and valued by leadership. Continuous learning. Now, one of the problems that has been that we don't even learn from our errors. Every adverse event, every wrong thing, for example, has to be treated like a treasure, because that is what can give you a lot of learning. But what happens because of the kind of the atmosphere, the environment in which we live, we sweep these errors under the carpet. We at KAHO, we have come out with a place in our website called Convert. It's a confidential reporting of the events. And at the moment, let's say we have about 140, 150 events listed there. We don't want the name of the doctor, not of the name of the hospital. But the issue is this, that every event gives us an opportunity as to why this happened and can be a great learning for everybody else. But we don't do that. So essential skills of an adaptive leader, I told you, let the big picture thinking you have to think of. So when we are talking about the patient safety, we don't have to think only about accreditation. We have to talk about how do I take accreditation to a different level of producing a safe environment. Emotional intelligence. Again, a lot of these things were talked that as a leader, I should have the broad shoulders to understand when people come to me with some negative kind of a thing that this is what has happened. If you are going to shout at your worker, they are not going to come and tell you anything about it. So let me kind of conclude it just by trying to tell you that the future of adaptive leadership in healthcare is the technological integration. That is, we must integrate today technology in order to bring about a lot of changes. A greatest example I can say is today, for example, the automated vital signs coming through technology should be embraced to help our nurses spare their time from that robotic, monotonous work to do something much more human and much more interactive with the patients. And cross-sector collaboration, partnering with industries outside the healthcare to bring fresh perspectives to the study. I think a lot of institutions must come together, and continuous evolution, we need to keep on thinking about how do we create a matrix for measuring the culture of safety rather than just checking box and getting accreditation. So thank you very much.
Yeah, thank you, Vijay. I think clearly your passion in patient safety comes through. I think we clearly understand that move from a culture of complexity to a culture of patient safety with a solution orientation that is more than an accreditation exam. I think that's fundamentally a key thing. I really like the systems adaptive leadership examples. Systems leadership, adaptive leadership, so let's coin a new term for that. I think moving from the person who is going to put patient safety clearly on the map in India to the quality man of India, Dr. Ram Babu specifically wants to make this introduction, so please, go ahead.
Now, before we call the third speaker, I would like to share my experience. 14 years back, I have attended one meeting to meet particularly one gentleman. My friend has taken to that meeting. Then one tall 6 feet person was standing there, and so much of crowd. Then I asked my friend, who is that man? He is a great person in healthcare. Who is that? I don't know, but he is a great person in healthcare. I've been asking him what is his name. I don't know what is his name, but he is a great person in healthcare. Then I was waiting after 10 minutes. When the crowd was dispersed, then I went and introduced myself to him. So I am so and so. Then he spoke to me 10 minutes. Believe me or not, from that day onwards I have become totally the follower, and he has become my mentor. And 3 things the great things what I have observed in him, one is, he is a very good listener. Whoever, whatever says, he will listen with smile. And ultimately he takes his decision, that is different issue. But he listens to everyone. And second thing is, his way of convincing the people, way of convincing what he wanted to do. Third one is the ever smiling gentleman. He is none other than Dr. Girdhar Gyani sir. And I am so lucky that I requested him to give foreword for my book, Reality of Hospital Administration, which I have published in 2014, and he has given the foreword for that book. And when I requested him, he came and even attended as a chief guest for the book releasing function. Thank you very much, sir.
Thank you. I think if I can say, I think your talk itself was a talk on leadership. I think that is what, the attributes you attribute, I don't know whether you said about me, but that are the attributes of a good leader. Anyway, I think today I realizing that first summit we did for half a day. That was actually for selected 50 people, invited we call it, We did it in Delhi, and 1/3 of them were from government, and it proved to be a very successful model. So this time we thought, let us do it for one day. And selecting Chennai was basically, let me be very frank, that because we wanted to felicitate Dr. Pratap Reddy. And I was told that he doesn't travel. So we brought summit in Chennai. But emotionally, I'm disappointed today because I wanted him to be here and I wanted him to be felicitated by our Tamil team in Tamil Nadu, in Tamil fashion, But anyway, his health doesn't permit. But still, we recognize him as a healthcare leader of the century. But today I'm realizing that there is so much to be talked about leadership and governance. So third summit will be for 2 days. Because what happens when it is one day, instead of 6 hours, it becomes 4 hours. Because people, I could see 20 of them have left their flight at 6 o'clock, 7 o'clock. So I think there is so much to be learned and communicated. And I'm very privileged that we got leaders like Dr. Madhuri, Dr. Kiran, Preeta, all of them, And when I talk of Dr. Rela, I think he's a, jewel of our country, let me call it. Like we recognize Dr. Pratap Reddy, he's another icon. I think so. What I'm saying, we will do it 2 full days next time. And this small talk, actually when in 92 I was trained in UK on quality and where I picked up a bit on healthcare also. So, they used to talk about the total quality management. I picked up those few ideas and tried to thought, let me, put this in this particular session. I'll be very brief because there are supposed to be 3 talks in each session. First session, second session. In third session, our organizing team wanted that there should be some spiritual guru. So we tried here and there, and then we found that we have one Swami among ourselves. So we got Swami Venkatesh. So he is going to talk about spiritual and leadership. So I think I will cut down slightly. This is the definition we were given in 1992. That how actually a joyful workplace. So what you have been taught by Ram Kumar onwards till now, to actually emphasis here is on the leader. And I think Dr. Kiran Bedi, I think the way she said, without showing any PPTs, that hunger, and whether you want to be leader or just you have been put in the position. I think these 2 things were very important from her talk. So I think here also the definition is very simple, that ultimately the leadership is the one which is driving, but driving is done through the empowered individuals. So that is a very important point. And that professor used to tell us difference between delegation and empowerment. And really that definition is very important. Delegation, I can delegate anything to anybody, but empowerment is making sure that you are delegating to the right person with the right tools and right attributes, things like that. So it is not very easy. That empowerment we keep talking very loosely. No, it is not very easy. You know, you have to do a lot of work on empowerment. You know, people actually keep talking about me that I am the one who created healthcare quality system. But I keep telling that I was privileged because I could get 5 senior doctors. And Madam Dr. Pavan was one of them who actually led the team of developing the standard. So choosing the right people and then leaving them, I think they did the marvelous job. So this definition, if you see, empowerment is the one, but ultimately the 2 lines which I want to read here is that accreditation, when we were launching in the country, it used to be very painful exercise. Employee used to see what the hell it has come now. Why procedure is required? Why SOP is required? We have been doing the job. But the here is that quality organization, the way you evolve, way you establish the system, way the leadership is working on empowerment, it should be very joyful exercise. And ultimate, what is the, you know, that if all this what you are doing must generate the highest level of patient satisfaction or customer satisfaction. So I think this small definition sums up what actually, now again, this is a very old model. This gentleman psychologist, you know, this was taught to us in HR subject those days. There used to be one paper on HR, although very small subject used to be there. But you know, this is what an organization is supposed to focus. Now, for example, any of you, I think all of you who are working in a hospital, all reputed hospital, I think left side is already fulfilled. You are getting good salary, good house, good position, good structure, everything is there. But ultimately, what is going to motivate is on the right side. I think that is where I think all of my previous speakers has taught about it, that challenging work, increased responsibility. You know, when we went to Japan, the person who came to receive us in the airport was a driver. We went, and then when we were visiting the plant, I saw that same person. I thought, but all Japanese look similar. You know, like sometimes Sardarjis look similar to me. But then I asked, this person looks similar to what he came to receive us. He says, sir, it's the same person. So we learned that multi-specialty and job rotation. They told us that if person is working on one workstation for 3 years, we shift him. Next job, or if there is no next job, at least the place we change, so that the monotonous aspect goes away. So these small things do make a lot of difference. Of course, this of course I will, for the timing, pass it on. I think something I think Dr. Madhuri mentioned about it, you know, that the leader is the one, because the president of USA, you know, mentioned, you know, this, the leader is the one who inspires others to dream more, learn more, do more, and become more. Of course, but I admire, same definition is by our own president. And you know, I had privilege of interacting with the president in the president house for good 2 hours. And that is what he definition gave to us. With me was one Lieutenant General Lal. Of course, he was from the armament. But you know, this definition of Abdul Kalam is very pertinent for all of us here. That leader is the one who creates leader. Simple. I think that everybody has talked about. But he added one thing, that good leader is the one whose disciples outshine him or her. Now that is the kind of broadness has to be among us. Can we, you know, many of us may not, you know, be, convincing, oh, that my chela can become better than me. But that is the leader, and that actually is the one which we have to keep following. And of course, this leadership is a style you must have learned, but what I'm trying to tell you is that many people think that transformational, democratic, and servant leadership you showed us, Dr. Leela, that inverted pyramid you showed. And so this is the servant leadership. But all three leadership components have to be tried in one. So don't think that if one is good in transformational, he will not be good in democratic. I think the good leader has to encompass all the three factors. Sorry, I'm a little rushing actually, because I want to listen to the Swami also. So this is, anyway, this open communication, empowering employees. Recognition program, I think, is the one. let me tell you, we lack. We are very poor in appreciating our own colleagues. Forget about subordinates. I think this art of appreciation among each other reflects back to us. So I think we have to inculcate that habit and culture, that how one person is recognition, you must go and hug him, recognize him, praise him, and things like that. That actually we are not able to do it. And of course, this is what actually you had made this diagram, inverted pyramid, that you know, that empowerment is because the CEO is virtually at the bottom, because he is taking all the burden on his or her shoulder, and the maximum empowerment in a hospital is supposed to be in the front line. I remember way back in Hinduja Hospital when I visited about 25 years back. They showed me, sir, this man is IIM Ahmedabad graduate, and he will look after our front desk. I was surprised. Normally what happens in the hospital, if somebody is nasty person inside, the in charge will say, put him in the front desk. But you know, this place I found, a IIM graduate was supervising the pupil in the front desk. So that is the important. You'll discharge the patient in 1 hour. In TikTok, they also are not able to discharge in less than 4 hours. But what they do is, once the doctor declares him that you are okay now, they shift him. There, television is there, he can have coffee, and so at least his mind is not that I am discharged.